are you?
My name is Ron Morganelli. I'm the Managing Director of the CareWell Health Group. We have a business located in Norwell at Sinope Park. It's called the CareWell Adult Day Treatment Center. We are new to Norwell, just 4 months young.
Oh, do you have other places?
No, this is our first private business.
Okay.
So we love being in Norwell. We're in a nice place.
Where in Norwell are you? So people can get an idea.
We're at 141 Longwater Drive, Suite 104, Assinippy Park.
Okay.
A lot of people may have remembered where the old Weirguard building was. The Weirguard building is now empty, and we have taken up 9,000 square feet of that.
I didn't know it was empty.
Yes.
They have gone completely?
Yes, they have a small business office that's located on the other side of the facility, the large complex over there.
So you're new to this. And is this your significant other?
No, this is Patty Gross.
Okay.
Patty, you can
I'm
introduce
Patty.
yourself.
I'm Patty Gross. I'm the program director for the CareWell Adult Day Treatment Center.
Your list of things was impressive. Where did you get your training and all? What did you do before?
I've been in the healthcare business a long time, over 20 years or so, probably more. And it started way back in the nursing home arena as even a CNA, worked my way up and was admissions director for several of the local nursing homes in the area. And had an opportunity, met Ron, and my goal now, which was previously to get people out of the home and into a nursing home, has done a whole flip, and I'm now trying to keep people home as long as they can and out of the nursing homes until need be. There's obviously a service for that, but a lot of times people are placed there prematurely.
Who decides, maybe you can answer this, who should go to a daycare center or who should go to a nursing home or who can be able to stay home? I want to stay home if I can.
Right.
But if I can't during the day, I think it would be a nice option to be able to go to a daycare center and then have somebody pick me up who can keep me at home at night in my own home.
Yeah, exactly.
My mother was in a nursing home. True, it was a long time ago, but I was never that happy. I always said when I left her, oh, I wish I could keep my mother home. Only because there were 3 to a room and it just wasn't the best.
Yeah.
She got good care and we couldn't take her because we all worked and we had no place like you to say, this is a perfect place for Ma, and then one of us will pick her up at night.
Well, I think daycare options as well as, in-home daycare, be it having people come in like my service provides, we're just seeing it more and more of a need because patients, clients are living either alone or with family members who are working or have young children of their own, and they just can't be there to provide that safety, overseeing socialization that is so important. And
I think giving the caregiver a break.
And giving the caregiver.
I think absolutely.
Yeah.
We see that so much, the stressed spouse who can really provide so much care, love, support, but they totally, for their mental well-being, need that break. They need to know that they can, let's think about spring, play 18 holes of golf a couple of times a week.
Right.
That's right.
Go out to lunch with a friend, and an option like Adult Day Health
And it's
provides
wonderful
that.
for you because I had a friend who, she took care of him. She got to be a little abusive. That's how stressed she was.
Yes.
Yes.
And he had to be taken away from her. She was a lovely person, but she could not. She was at her breaking point.
Yeah. Respite is so needed for the caregiver. And Adult Day Health does give that opportunity for respite, that much needed respite. And it's not a luxury, it's a necessity.
Are they covered under insurance? Is there anything that
Yep. Coverage is under, for us, it's private pay or Medicaid.
Okay.
And Medicaid will take care of the 6 hours of stay at our facility as well as transportation.
how marvelous. Do you come, we're driven up, I'm saying we're because I'm in that, or any category, but you take them how old? How old can people be to come to you? Well, all ages, you said, right?
Yeah, all ages.
Yep, all ages.
18, do you have a cutoff of, any particular cutoff of age?
No,
No.
No.
325.
Yeah.
But what about how
We have
young?
people right now that our youngest is 26 and our oldest is 93, I believe.
Isn't
Yes.
that wonderful?
So, and they integrate so well together.
Now, but let's talk about that. You're challenged because the 93-year-old and the 18 maybe in different places in time. And do you have people walking around? Do you have nurses, doctors?
Yes. We
who
have
prepares
nursing
the meals?
staff. We have Ron is our head chef and bottle cook.
How lovely.
But he actually, it all works out that yes, we do have nursing oversight. We have CNAs. We have direct care aides, which assist with all the activities because our whole program is activity driven. They're to be stimulated while they're with us, not just sitting there doing nothing. So we have a very robust activity department.
I'm not looking at a wall just sitting there. I'm doing
Yes,
something. I'm engaged in whatever I can do.
absolutely, Yes.
We have a 9,000 square foot facility that has 7 different activity rooms, plus an outside therapy patio, which in the spring allows people to go outside, get some fresh air, and have the therapy of gardening. So we'll have 6 or
Lovely.
7 raised garden beds where folks can plant their vegetables and flowers, and that's an activity and that's a therapeutic activity. Along with getting outside, getting some fresh air. You know, mom and dad loves to go outside, so if it's nice outside, at our place you can go outside.
And what about I like to be healthy, exercise? Can I walk around? Can I do
Yeah, it's
something?
we have a large area. There's even a whole walking path inside because it's all set up so you can just walk in a big square, circle square.
Security there?
It's all secure.
I can't leave and go off?
No,
Okay.
it's all a secure facility, and
What do you feed me? I have
Yeah.
high cholesterol, maybe high blood pressure, maybe whatever. I can't have this or that.
We have a third-party vendor that we've hired to bring in food, hot lunch every single day at City Fresh Food.
Do you give me breakfast, or I've had breakfast before I come to you?
So a typical day is you come in the morning, whether that's from our transportation bus or you're dropped off by your loved one.
Oh, you have a transportation
And that's
bus.
for
Good.
8 o'clock in the morning. Our hours from 8 in the morning till 4 in the afternoon. So folks will come in, and from 8 o'clock to 9 o'clock, that's kind of like the people are coming in, they're having like a continental breakfast, they're having juice, coffee, a lot of fruit. We push a lot of healthy stuff in the morning. They'll have coffee if they want.
All day coffee if you want?
Yeah, all day coffee.
Good. Decaf?
Decaf.
I'll be there. Yeah.
There is
All
no caffeinated. And, you know, everybody's on an individual care plan, and that part of that care plan is their diet. So we know exactly
What I can have.
what you can have.
That is, how do you love it? What did you do before?
Well, I have an interesting background. I come from the financial services industry. For about 28 years, I worked with the mutual fund business. A year ago, I took a nice package, and I said to myself, I need to reinvent myself.
Oh,
So
marvelous.
I did a lot of research. I talked to a lot of people. Dr. Paul Rea from the Alzheimer's Association kind of said to me, you know, there's a business that you should really look at. It's the adult day health, because at this point in time, there's not enough of them around, not enough facilities around. So I did the research, and it was a no-brainer. So it was something that I'd love to do. I think it was a calling for me. It's totally different from what I did in the past. I like to work with the community. I like to give back. You know, I look at myself as very fortunate. So here's an opportunity for me to reach out to the community, help people, because I love helping people.
That is wonderful.
And
How
I've-
far do you go? How far do you pick me up? If I live in Revere, would you go? I
Well,
mean,
private pay comes from all places. It can come as far as Hull. It can come Brockton.
Excellent.
But if you're on Medicaid, we have a 15-mile radius that we need to stay in.
What would that be?
That's all the towns that
Well, we've
basically
actually-
touch Norwell.
Yeah, but we have them from Quincy to Plymouth,
Yes.
really.
Excellent.
Yeah,
So-
which you're in a good central
Yeah,
location, really, for
we
that
really are.
catchment area.
Am they happy to go? Do people, when they're being dropped off, do they want their loved ones to leave? Are they okay with it? When you pick them up, do they realize where they're going? Are they okay with it? I mean, are they with it?
They love our place. In fact, we have one participant, when he gets up in the morning, he puts his jacket right on because he's so anxious to come to our...
Do you have TV?
We do have TV, but we do not promote watching
Good.
TV
I
during the day.
love it, loving it. You know
we
what
do
the
not
Health
promote-
Association says? 8 hours a month of watching TV.
Yeah, our
Because
facility...
it doesn't stimulate the brain
Yeah.
much.
Yeah, our facility is built to be a very therapeutic environment. So the colors, the lighting, the furniture, the flooring,
Oh, I love it.
all is to provide a therapeutic
I
environment.
had occasion to tour the
Patty's been
facility,
there, yeah.
and it is so impressive.
Is that so?
So impressive.
What are the colors? Because now everybody's into
Bright
colors.
Yeah, bright colors.
So we have 75 candle watt light. That is very bright, just like these.
Maybe
we
this is
have
brighter.
very
A little
bright
brighter here.
primary colors on the wall. And that all helps to stimulate the folks. In fact, Patty and I joked that the first couple of weeks at the center, we were so stimulated with the colors that we couldn't even watch the 10 o'clock news at night. We were so exhausted by the time we get
Is
up.
that-
But our role,
What if I have to nap? Is that taken into?
Yeah, we do have
Okay.
a quiet room,
Okay.
and
sorry.
it's much less. We have a dimmer light in there. It's a nice, tranquil blue seascape type room, and there's recliners, really nice leather recliners that they recline all the way back to almost the whole laying position, but they're also the ones that can come all the way forward. So if you need help getting up a sitting position, it will launch you forward enough to a standing position. And they all have heat and massage.
Very very
nice.
soothing room.
Do
Yeah, it's very nice.
we all eat together? When you
Yes, they do. Yeah.
And is there interaction?
there's a lot of interaction. Socialization is one of the most important aspects or components of
I
our
agree with you.
facility. You know, mom and dad are sitting home by themselves, they're watching TV, there's no
Yes.
socialization. So what we do is we make sure that people are, you know, together. They have new friendships. They do a lot of different activities together, and they just enjoy being together.